Good afternoon, happy spring, happy 2022. I know I have been gone for a while, but here we are, season 2, can you believe it, of the Rhythm Notes of Health podcast. And we are starting this year off with doing some exciting things. We've been talking about screenings, even though I haven't been doing the podcast. I've been on a lot of radio shows, doing a lot of in-person events, which I'm excited about. And we have been talking about screenings. And today we're going to bring on Dr. Luther Burse, and he's going to be talking to you about acid reflux, in which while my voice may be sounding like it sounded, it could be we're talking about acid reflux. It could be what's going on with my voice. We're going to find out today. We're going to bring in Dr. Burse, and we're going to get started on acid reflux, the plain truth. Let's bring in Dr. Burse. Dr. Burse. Hi, Dr. Burse. How are you?
Good. How are you?
I'm well. Welcome to the Rhythm Notes of Health podcast. I was just telling everyone I'm so excited. Season 2, and we're talking about things that go on in the gut, right? What we all need to talk about. So today we're talking about acid reflux and the plain truth with Dr. Burse. And I want to tell you that Dr. Burse is actually the husband of one of our Blackpink advisory team, Dr. Janella Burse, who is you're very familiar with. She's been on here several times. And so I called her and say, hey, I woke up one morning and I say, you know what? I need to do a podcast with your husband. Oh. I woke up and it just literally, this is the podcast that I need to do. So I'm so excited to have you here with us today. He's a Morehouse man. You know, I'm always having these Tuskegee people on here. But today we're still in the HBCU spirit, and we have Dr. Burse, who went to Morehouse. You know, Dr. Burse, I often say things of that nature because people, you know, they don't give our HBCUs the credit that we should have, and they're not clear that we produce smart people, right? And highly at the height of their game people, in which you are, in the doctors that are on a part of the panel. I think I only have one doctor that didn't go to HBCU, and she's probably mad that she did because I go on about it so much, right? So welcome to our the Rhythm Notes of Health. And Dr. Burse, the first thing I want to do, Dr. Burse, before we go any further, is I want you to tell everyone. Now I'm going to ask you, and I'm going to ask you again in the end, to tell everybody who you are, what you do, and then we're going to talk about what is a gastroenterologist. But first, tell everybody who you are, how they can reach you, if they can reach you, where they can make an appointment, because when we're finished with the show, they're going to want to make an appointment. So let them know how they're able to do these things. So exactly, who is Dr. Luther Burse?
Oh, thank you. Basically, I work with it's called Medicura Consultative Gastroenterology. I'm originally from the Philadelphia area. I grew up right outside of Philadelphia. I went to Morehouse, as you said, and I trained at Morehouse School of Medicine, and then Wayne State University in Detroit. And then I went back home to Philadelphia to do my GI fellowship at Temple University.
Okay.
I'm a specialist in gastroenterology, which is basically ulcers, intestinal disorders, and diseases involving the liver. My office number is 404-881-8800. And you know, we're always taking new patients, so we love to have people come. But you know, you mentioned earlier about HBCUs. You know, actually studies show that there's a greater majority of minority physicians actually come from HBCUs. The majority institutions.
Okay, so, Dr. Burse, I like that. See, this is how you know you have a smart doctor on. He come on with giving stacks. Like, let me just tell you who we really are. I like that because I often say that the Rhythm Notes of health was birthed out of the need of Afro descendants, of Black people to understand more about their health so they can partner with the doctor and empower themselves, and they're able to ask questions because we spend more time with ourselves than the doctors do, right? And so that we can have a good partnership, and the only way that can happen is for us to be able to understand and know what questions to ask. So I like that you start the show off with coming educating us. Like, let me just give you this fun fact for all of you who do know. Y'all take that to the bank and roll it, and let me know where the dice land at with that one right there about the HBCUs. I am totally with you because I have a lot of smart friends, right? And they all went to HBCUs, so that's gonna be that. So welcome, Morehouse man. I think you're my very first Morehouse man. Yep.
Well, you definitely should be the last, then won't be.
Oh, you exactly. Because listen, because when I was down doing the Tuskegee run, I would have like 3 doctors back to back, and I was like, oh. And we went to school together, right? So it is just like wonderful to, you're in college with these group of people, and you all have your major and what you're going to do, but to actually see the other side where you persevere through and you get to the other side, it's really good to see everyone doing well in their field that they wanted to, of course, go into. So before we get into acid reflux, the plain truth, could you tell us what is a gastroenterologist? And you pronounced it differently. I heard that. So I'm really big on enunciation of things. So you pronounced it differently.
You're right.
I said
gastroenterology.
Gastroenterology. Okay.
Right, gastrointestinal disorders. We specialize basically in the bowels, from the mouth to the rectum. And so what we do, most people know us mostly for colon cancer screening and colonoscopies, but we also deal with liver disorders, the gallbladder. We also deal with problems with swallowing, and as we're talking about today, acid reflux, and anything from the Rudy to the Tootie, as we always say.
Okay, and so most people, in order to get to the gastroenterologist, they have to get a referral, correct? Most people
Go ahead, I'm sorry.
No, go ahead.
You have to check with your insurance. Quite a few of them require referral, but some don't. Mine
don't. I try to educate the people to say, hey, get an insurance where you don't have to get permission to go see a doctor of a specialty that you feel like you may need, right? Because then your internist is kind of controlling that, and it's like, well, may not need it. You know what I mean? So I like having the power of my health for me. So that means that I probably would have to pay more for my insurance, right? But that's just the plans that I choose to have, that I like to be able to select who I go to, right? So I chose acid reflux because in the last month or so, I have spoken to about 3 or 4 friends, and they are talking about their acid reflux. Like they'll say, I had acid reflux, I'm managing it now, or some are just saying my acid reflux is messing up. And it's become such a common conversation amongst most of us, right? Acid reflux, we hear people burp. I told my friend I was gonna talk about her. We can be in a conversation and she'll have this loud burp. And she act like it's not even rude to do it. I'm like, you clear, that's just rude, right? And so I told her that, I said, I'm gonna talk about you. I'm not gonna mention your name, but I'm gonna talk about you on the podcast, because she does this, is so common, and she'll say, well, my acid reflux is messing up, like as if, I told you I'm from Mississippi. And so, in Mississippi, they always talk about things and this happens. And if you do this, right? She's from California, but she sounds like she's from Mississippi, because she'll say, well, my acid reflux is just acting up, right? And she talks about it as if it's just the thing for it to happen. My acid reflux is messing up. And so I tell you that for the most part, I had acid reflux really, really bad, right? And for me, I manage it by taking probiotics and by knowing, don't eat this food around this time, don't do this, don't do that. So I manage it through my eating, right? But like now, because the one thing that we forget about, and we're going to talk about, is that stress is a big cause of acid reflux, right? So we talked about it before the show started, that I got a lot of stressors going on right now, right? So I think that my voice right now, and I'll get in trouble with the vocal doctor and the vocal therapist because it sounds horrible to me because I'm hypersensitive at the sound that is probably the acid reflux. And today I'm gonna learn how, I'm gonna learn why and how that is from you. So Dr. Burse, let's just get in. And y'all know whenever I'm on here with the doctors, I'm always really conscious of time with them, although they get on and they tend to have fun and then the time kind of slips by them. But so let's just get into GERD, right? GERD, gastroesophageal reflux disease.
Right.
Is that what acid reflux is?
Yes. Now, that acid reflux is probably one of the most common GI illnesses. And now, GERD, or gastroesophageal reflux disease, everybody has episodes of reflux. So it's not uncommon to have reflux. I mean, if you Taco Tuesday and people margaritas, they may wake up Wednesday and have had bad heartburn. So patients who have persistent symptoms, typically more than 3 episodes in a week, those are people that you think more typically about GERD. And basically what it is it's just reflux of the gastric juices from the stomach into the esophagus. There's what's called the lower esophageal sphincter, which is kind of like a door between the stomach and the esophagus. And that door, when you eat, it should be closed so that so as your stomach is digesting the food, you don't get any backflow of the acid. Well, certain things like coffee, things with caffeine in them, tomato paste-based products, sodas with caffeine, all those things can kind of loosen that door and cause reflux.
Okay, so you said that you're referring to the sphincter as the door, right? Okay, so the sphincter is a muscle, right? Right. So the sphincter muscle is at the bottom of your esophagus, right? And so your esophagus runs from your throat right down through your chest. This is why somebody like, they may like touch the top of the center of their chest, is I got acid reflux, because right in that area of, I guess, the bottom at the top of your breastbone, I guess, would be,
Right.
That would be the bottom of the esophagus.
And you actually have 2 doors. There's a lower and an upper.
Okay, so you just talked about the lower. Okay, so I just make sure everybody's clear on the lower.
Right. So that's typically where people talk about having heartburn symptoms.
The heartburn. Okay, so the lower, so you're speaking of the door is the sphincter, that the medical term, right? Which and I like that you clear on how we do on here at the Rhythm Notes. We don't break things down, so you come in and breaking things down. I like that. So the sphincter will be the door, right? You're using the sphincter as a door. And so the sphincter is a muscle at the bottom of the esophagus, right? And so that door or that sphincter is supposed to be closed, right? As you're eating.
Right.
And as juices, or because you need the juices for the digestion in your stomach. So as these juices and digestion are going on, that door or that sphincter, it's supposed to be closed, right? But long term of doing things that you're not supposed to do, coffee, that's me, I'm raising my hand. I'm going to throw out my whoop in there. Okay. Coffee, caffeine, as you said, sodas, foods.
Alcohol, smoking.
Alcohol, smoking. Ooh, those things weaken that muscle, correct?
Well, they basically not necessarily weaken it, but like loosen it so that it doesn't, during that particular time, is not closed as tight. So it's
not closing time. Okay. So that's the lower door. You said there are 2 doors.
Right.
Now, where's the second door?
The upper one is basically near the top, like when you swallow your food, transferring from your mouth to your esophagus or your food pipe. So that's where people who have problems with like chronic cough or sore throat or hoarseness, that acid can reflux all the way up to the top and irritate.
Okay. So in essence, it's 2 doors, right? And if the first door don't remain closed, if it opens up,
right,
there's another door up there right? There's like, okay, that door open, the first door open, but I suppose it remain closed, right? But over long term, then that door now opens, right?
Right.
Where
And right. And you can have problems with asthma,
mm-hmm,
like I said, chronic cough,
mm-hmm,
hoarseness is
mm-hmm,
a big one. And reflux can also present with atypical chest pain.
mm-hmm,
So it can present with a myriad of different symptoms that
mm-hmm,
aren't necessarily, what we consider classic heartburn. Somebody
mm-hmm,
can have a problem with chronic cough and not figure it out, and it turns out that it's acid reflux.
mm-hmm. Okay, so just to be clear, your esophagus, right? And I feel like I need to go. See, if I always say this on these shows, but if 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 your teachers, instructors were just broke things down in this way and use it in everyday life, then everybody would probably have an A in biology and chemistry and those things, right? So your esophagus, right? Because I can see the esophagus, but I'm trying to vision these doors or these muscles, right? So at the bottom of the esophagus, right, that extends down into your chest. So that door, that sphincter muscle covers the bottom, because the esophagus is like a tunnel, right, where the food and beverage and things travel, right? So I would say at the bottom of that tunnel, the bottom of the esophagus is that first door that kind of extends down into could go down to your stomach, right, or to your chest, your stomach, right? And and so that sphincter or that door, and when it doesn't close or allows this acid to come up, it then goes to that second door, and then when it is not working or functioning, right, then now you have the laryngitis and all these other things that you can have. And when it comes up in your throat, matter of fact, that was my first introduction to, I had acid reflux, right, is that we were in Texas, right, eating Mexican, and I love Mexican, but I always had margaritas with the Mexican. And I was in Texas, and the first time I'm laying down to go to sleep, and then it's like the acid, it comes up, and I have to sit up in the bed, and I really didn't know what it was. I'm like, what in the world is this, right? Now my chest starts to burn and all these things, and over time they just tell you to, take these pills, right? But growing up, I remember my father and my mom keeping some Rolaids or Tums with them at all times. They had acid reflux, or it was acting up. They acid reflux, or their reflux, I should say, is because it's the reflux is the ability of the juices to come back up, right, when it's supposed to be going down. So it's the reflux because it's coming back up, right? And of course, is the acid is what comes back up, right?
And that's how sometimes you get that bitter taste in your mouth. That's the acid from your stomach.
That's the acid from your stomach. And over time, it can cause erosions, right? Okay, no worry, we're going to get into that. No worry. So I was reading that that only 15% of population have acid reflux or GERD, I should say. Now, is that true? Because that number seemed real low. Because I would see if I count 5 people.
Actually, 10 to 20, 15 to 20% of people. But they're talking about the disease.
Okay, understood. Okay.
But the vast majority of people have reflux. Some episodes of reflux. Because you will get, there's another thing that that you can get, what they call transient relaxation of the esophagus, which happens on its own. And what we call is physiologic. I mean, sometimes you can the door might open a little bit on its own. So people will have episodes of acid reflux, but GERD is someone who consistently has reflux and needs either medicine or some intervention to relieve their symptoms.
Okay, so you broke down this whole diaphragm so we can understand what happens when you have this. And so what you just said is most people, or everyone, has an episode of reflux at some point, right? Where they're eating bad or doing something. It's the continuations. Like, how do you conclude that they now have GERD or esophageal reflux disease? How do you conclude that?
Well, usually if you have more than 3 episodes in a week, consistently reaching for something to relieve your symptoms, that's pretty much classic GERD
That's
symptom.
classic GERD. But most people
Yeah.
are able to manage it, I guess, like my mom and dad did with the Rolex and the Toms, huh?
But you know, the truth is, this is America, so you know everybody wants to eat what they want to eat
Yeah,
and feel at it.
yeah.
If most people just change their diet, exercise, and you know, eat right, they wouldn't even have problems, significant reflux symptoms problem.
They will be able to manage it,
Right.
right?
But you know,
So
there are some that you know, they just have bad reflux.
that reflex, okay. And so what are some, which brings me to Dr. Burse, what are some symptoms that people have? Now I could probably tell you, because I could tell you when my acid reflux is up. Since we got the professional here and this is what you do all the time, we're gonna let you tell us, like, what are some symptoms of acid reflux?
Well,
Yeah.
okay, well, classically it's the burning, you know, the
Mhm.
chest pain, the discomfort, the burning, maybe bitter taste. Now, you know, like I mentioned earlier, you know, you can also can have some people can have reflux induced lung disease like asthma,
Mm.
chronic cough, sore throat, hoarse hoarse voice. All those can be related to acid reflux.
Okay,
And,
okay, stop. You
mhm.
said some people can have reflux lung disease?
Well, they can get what's called you know, they've been treated for asthma, things like
Mhm,
that, and it
mhm.
turns out that it's all been induced. They have hyperactive airway uh, disease related to constant reflux, where they're actually, you know, they're aspirating some of that
Acid.
acid, and it's causing irritation to the lungs. So they can have problems with lung disease and chronic cough.
Hmm. So that, hey, let me tell you something. You know how the doctors say the doctors will be the worst patient, right? Because they know too much, right? I'm
Um,
starting to feel like that as public health educator. I'm just starting to feel like the more I know, the more I'm like, I'm
don't
self-diagnosing.
claim
Wait a
it.
minute.
Don't claim it. But you typically, that's pretty rare, the chronic
Uh-huh.
cough, shortness of breath, those things. But
Uh-huh.
the main ones is really the heartburn and you know, sometimes a sore throat.
Mm-hmm.
Also, you can present with what's called dysphagia, where you
Mm-hmm.
feel like you have trouble swallowing,
Mm-hmm.
or you can have what they call a globus sensation, where you feel like something is stuck in your esophagus. Get this funny sensation that there's
Mm-hmm.
something in your esophagus.
What did you call that? You called it global? What do you call it?
Globus,
Globus?
yeah,
Globis?
GLOBUS.
I have one of my doctor friends always on like, don't ask me how to spell. I don't know how to spell that. That's what I do. I don't spell. So when I say it, that's like, okay.
But the other thing, the biggest thing you worry about with persistent reflux, like you said earlier, it can cause what's called erosive esophagitis, where it can
Mm-hmm.
cause ulceration to the lining of the esophagus, the chronic acid exposure, and it can
Mm-hmm.
lead to what's called Barrett's esophagus, where see the esophagus is not used to seeing acid. So
Mm-hmm.
cells that grow in the esophagus are different from the stomach and this small intestine. So
Mm-hmm.
the body's way of adjusting is to make their cells more similar to the intestine. And you can
Mm-hmm.
get what's called Barrett's esophagus. And Barrett's esophagus is where the, you know, the lining changes to more like small intestine, and that can put you at increased risk of developing adenocarcinoma or cancer of the esophagus.
Okay. I'm glad you said that. So what happens is over time, and like you said, extreme cases,
Mhm.
then right, like I tell people, if you don't eat beef and you don't eat pork, then your body stops producing the enzymes to digest those foods because you no longer need them, right? And so sometimes when people eat beef or pork who don't eat it, they instantly get sick because their body's not producing the enzymes anymore, right? So what you said about the esophagus is that over time that it can change how it looks to adapt to this acid. Like if you're going to keep having acid coming up, then I got to adapt to, I got to create these cells that now is going to.
Everyone gets that, but it can happen.
It can happen.
Yeah.
Right. Exactly. Extreme case. So right. then the esophagus of that part of the cells starts to harden. So it can now protect you against right. this foreign thing that's happened, right? Because everything in your body needs to be where it needs to be, and if it goes somewhere else, we got to figure out like how to keep it from going to that other place, right? That was very, Dr. Burse, that was very good in the explanation of this is what can happen in the changing over time of adaptation, if you will, what science is like, you know, it's a scientist, what we are, you know, we all adapt, like we've adapted to the environment or not, right? With the eating or not, because although our parents may have been having these Tums or Rolaids that they were chewing, they didn't have these, it wasn't all of these over the counter things that are out now, right? And so they were able to manage because they ate bad sometimes. Now things are like really worse, right? So which I don't want to jump ahead of myself. I just want to make sure that we're clear at these symptoms that you have, and when should you see the doctor with your symptoms?
Well, like I was saying, if you have more than 3 episodes, and you consistently are having these episodes over a month span, you should at least go see your primary care physician, and they can decide whether they probably would start you on some medication. And if it didn't improve, then refer you to a gastroenterologist.
Okay, so now see, that's, you know, Dr. Burse, you know what I always say? I always get doctors on the show that are so comfortable in their skin that you said, hey, go see your primary doctor, right? Like you don't have to like jump and come see me, right? Go see your primary doctor, right? But if they wanted to just come see you, they can, right?
That's fine.
Okay, that's fine too. So, you know, go see your primary doctor and they'll probably try and manage it through their office first. And if they're not able to manage, they'll then refer you to you, right?
Right.
So we talked about the anatomy or the structure of this esophagus down into your stomach. So, and we talked about the symptoms. So when a patient comes into your office, right, how do you diagnose them to either have, so if it's 3 or more, then it's probably GERD 3 times a week?
You know, well, like, you know, 3 episodes in a week.
Then it's probably GERD.
It's consistent. You know, if you have a bad week of reflux, it may not be, but if you're
okay, like a week over here, a week over there, it's nothing. You just need to settle down your foods and your drinking and
consistently every week, or at least a couple weeks out of the month, then that's more consistent with GERD.
Okay, and changing the behavior, affecting your livelihood in a way, right? Yeah. Okay, so then the person comes into your office, right? How do you then diagnose that it's at a state of GERD, right? Or you just have a reflux we need to try and manage? How do you diagnose it? Because we know, and we're doing a show on colonoscopies, we know that we have the colonoscopy to look at the colon and that. So, but how do you look at the esophagus and that part? How do you do that? Let's just start with the first coming into your office. Like, how do you?
Typically, just a history and examining, you can tell whether or not somebody has symptoms suggestive of GERD. And what we would usually do is start them on an antacid medicine. Now, there's a bunch of different antacid medicines. You can actually, there's some over the counter. The ones that we use the most are what are called proton pump inhibitors. Those actually block the hydrogen pump, which helps to make acid in your stomach. Those are the ones like you see on the commercials for omeprazole, Prilosec, OTC. Those are the ones that we use. We tend to write a stronger dose than the ones you can buy over the counter. But sometimes if you got, you know, a bad couple of days of reflux, you could buy one of those over the counter and try it and see. Obviously, if you give it a try and it doesn't work, then you need to see your primary care physician. But There are others called H2 blockers, like Hepcid, and then there's ones that actually are what are called cytoprotective. They kind of coat the stomach to help reduce acid, and one is called Carafate. But the the Tums, those still work for mild symptoms. So, and especially women who are postmenopausal have, risk of osteoporosis. More calcium, the better. So,
okay, so I'm gonna come back to that calcium. So you said that the over-the-counter medications that people get the most is, you said it was a proton pump inhibitor, and you said that because the stomach and what it does is that suppresses the hydrogen. What did you say?
Well, acid is HCl, right?
Say it again.
Hydrochloric acid. Acid is made up of hydrogen and chloride.
Okay, go ahead.
So the proton pump inhibitors, they actually block. There's a pump in the cells that add the hydrogen to make the hydrogen chloride to make acid. So proton pump inhibitors actually inhibit that pump to some degree. I mean, obviously, not
because what causes the pump to be overactive? The foods and those things, and
right,
stress and all that. Okay, so, but listen, I like that you're talking about this hydrogen chloride and stuff, because it just took me right back to science class, and they just should have made it easier. I swear. You saying this to me, and I'm like, yeah, this makes so much sense now. So when inside of the cell, this hydrogen chloride, when the hydrogen is too much hydrogen, right, and not enough to balance that formula, right?
Well, it's not so much too much, is that it's being stimulated.
It's being stimulated
by bad diet, or sometimes it is just make too much. But the proton pump inhibitors help prevent that pump from produce. It helps reduce the acid.
Okay, it helps reduce the acid. Okay, so let's talk about some causes, and you did mention some causes, but I want to really talk about them specifically, causes, so people can understand what they're eating, what they're drinking, and be better stewards of their health, and including me. I just need to give up that coffee.
We all are struggling in that fight. But the biggest problem is, you don't want to eat late at night, because if you eat late at night, you need to sit up for at least 2 to 3 hours. Because when you lay flat, then gravity, that acid will just sit there. So you wanna try to avoid citrus products. I mean, most people know what sets their reflux off. So things that bother you may not bother somebody else. But typically, like citrus products, like I mentioned, anything that has caffeine, chocolates, all they can do it. Peppermints, the little church candy, can also cause reflux.
Yeah. What is peppermint? Do you know what peppermint does? It causes the reflux?
It's part of that whole leaky door thing. It just causes a little the sphincter to relax a little bit. But yeah.
The peppermint candy, and one of my big triggers is, I was telling you about the Mexican food, is the corn. So corn, because like you were talking about foods and diets in America, a lot of foods have corn in it, right? People don't even know it, and corn just my body's like, let that corn. I'll tell my daughter, like Cheetos, those type of things, and Fritos, and I can't eat those. Now, I'll eat the Mexican chips, but again, it drives my husband and my daughter crazy because they love Mexican, right? They have the same palate. They love Mexican, but they know if they ask me to go to a Mexican restaurant, it's got to be in the middle of the day, probably on the weekend. I'm probably gonna stay up longer. It's so many variables that they don't even ask me, because it's like, or I found 1 or 2 that has salmon, right? So if I go to Mexican restaurant, I'm eating salmon. So that's no. I like one particular Mexican restaurant because they have salmon, and I normally eat the salmon and not the Mexican foods, because I don't want to try to have these triggers to happen, to me. And they're always. Was that now?
A lot of that's related to spices too. A lot of those spices may set some of that off. But clearly, fried foods, greasy things that require a lot of your stomach to digest probably produce more acid, which increases your risk of.
Okay, I like that you right there, Dr. Burse. You said things or foods is what we're talking about, or beverages that requires more acid to break down, right? And so since you are the doctor of the stomach, if you will, because you need you need some acids to break down your food. Or they always say also to digest some medications too, right? You need acid, you need some acid, right? So we're talking about the overproductions of it. And so sometimes foods, because it's not made, it's what am I, synthetic foods, right? That they're genetically made in the lab, right? They don't come up from the ground and those things. So then our body's like, what's this? And even over time of evolution, right? Because way back we didn't eat like this, right? So even over the time of evolution, our body is still trying to adapt by saying, ooh, how do I break this down, and giving more acid to break down.
Well, clearly, I think we know that processed meats increase our risk of like colon cancer. That's why,
you said processed foods.
I know like bologna, salami, things like that. I also see prisoners. There's a lot of colon cancer in the prisons, and I think a lot of it has to do with the ingestion of processed meats.
Oh wow. Yeah, so you see prisoners and you notice that they have a higher rate of colon cancer, and because of the processed foods, right? That's not natural, that we shouldn't be eating, but they push down our throat with all these commercials and those things, right? Okay, so we don't get into the nutrition of it all, but I'm just throwing in a little extra piece. So these foods, these foods that we eat causes the acid. And so I also read that medications also can trigger this acid reflux, correct?
Correct.
Like antihistamines.
Well, if you live long enough, something is going to affect something.
I know, Dr. Burse. See, this whole antihistamine thing, because I have been suffering from allergies since they used to have to hold my nose and throw the red pill down my throat because I couldn't swallow. And what I know now, that was antihistamine, right? So, but I was reading this and I'm like, oh, I never heard of this. Let me ask Dr. Burse. But Dr. Burse, so do you know that to be true?
Well, I've been seeing a lot of patients who've had problems with antihistamines and reflux, but if you look if you read the physician's desk reference, which is basically for the different medications, there's so many side effects that I wouldn't be surprised if
antihistamine is one of the medications. So do you know of any medications that that triggers acid reflux?
Well, it's more so the not so much that trigger the reflux itself, is the whole system of the things that can loosen that door a little bit. So I mean, there's none that I would say right on hand that definitely themselves can cause. That I can think of right now, but
yeah, understood. No, understood. No, that's fair. Oh, because just so you know, I never tell the doctors the questions I'm going to ask because I want the show to be authentic. And they're all so smart that they tend to know all the answers. But like I said, I had one of the doctors always said, "Don't ask me how to spell that word because I don't know. I don't know." There you go, ask me how to spell the word, and that's really for my enunciation, so I'm able to articulate, the proper enunciation of something, so I can empower someone else to do the same. So we've talked about the causes, right? And the symptoms and what it is, and so prevention.
Just eat right.
That's a blanket statement. Like, what do you mean?
Try to increase your water intake. Like we mentioned, those other things to try to avoid but you really want to just try to exercise. Make sure you don't eat late at night. If you do, sit up at least for 2 to 3 hours. Have symptoms of reflux and it's bad at night, then you should lay on at least a wedge pillow or something. Try to keep your torso lifted to about 45 degrees. So you kind of let gravity help you out with the reflux. But diet, weight loss, exercise, all of those help. For the people who, those don't work and the medicines don't work, then there's surgery. But we try to avoid surgery if we can.
So what do you do well, I'm going to ask you about the surgery. First, I want to ask you about, you said, and one of the things that you said for maintenance, you said water intake, right? And I often talk about water on the show because, I always say, as you guys say, the solution to pollution is dilution, right? So in this case of acid reflux, that's what the water does also. Yeah, it helps to dilute it helps to dilute the acid. So because I recently had a friend that said that she was watching social media something, and they said that the water, America's pushing water on us because they want us to buy these water bottles and buy these waters and all these things, and that we don't need that water in our body. I said, listen, that's rhetoric. The solution to pollution is dilution. That's what I said. I said, so please don't let anyone tell you that you don't need, they're trying to kill you. You need to drink some water for lots and lots and lots of reasons.
And you don't have to buy these.
Correct.
But water definitely helps with your kidney system. It helps with your bowels, especially people who suffer from constipation. Increased water intake will help move your bowels as well.
That's absolutely. We're gonna talk about that when we're doing our colonoscopy show, Dr. Burse, about all those things. So I also read, Dr. Burse, that one of the causes of acid reflux could be a higher hernia, correct?
Yeah, well, hiatal hernias don't necessarily cause reflux, but they can aggravate it.
It can aggravate it.
Right.
And so
the hiatal hernia basically is where the esophagus comes down through your chest, through your diaphragm. There's an opening for the esophagus. Well, sometimes the top of the stomach can kind of poke through that opening and cause a hiatal hernia.
What type of stomach? What you said? What? Copulus? What was that?
No, the diaphragm, there's an opening, right? It goes through. The top of your stomach, connected to your esophagus, can sometimes poke up through that opening.
And that's what they call the hernia, because it's like the fatty tissues there. Right. Okay. And it calls it higher because that's top of the stomach.
Right.
Okay, so that's so new.
Because of the hiatus, the hiatus as a hiatus. So it comes through there. So it herniates through the hiatus. So it's hiatal hernia.
Oh, that's what the area is called, the hiatus.
Yeah.
Which part is called the hiatus?
The opening in your diaphragm.
Okay,
Where your esophagus is to go down through.
Okay, understood. And so that hernia sometimes can be a blockage.
Well, no, it just kind of pokes up in your chest. It can cause like added pressure to the sphincter, so it makes it harder for it to close.
Open and close then in that case.
So it can add, well, not necessarily close, but it can kind of push more things through it. Or reflux symptoms.
And so we know that we do the colonoscopy to look through the rectum, right, area at the what do we do? How do you go in and look for that and see if you have this high hernia?
We do what's called the upper endoscopy, or ED, or scope. People talk about the light getting passed down. So we take a tube that's probably about the size of your pinky, a camera and a light on the end. You just like the colonoscopy, we give sedation, go down through the mouth and look at the esophagus, the stomach, and the first part of the small intestine. Usually takes only about 5 or 6 minutes.
Mm-hmm.
We'll be able to see if the reflux has caused any damage to your esophagus, like I mentioned before, if it's caused any narrowing or stricture, narrowing of the esophagus, just from chronic inflammation, or if you have a hiatal hernia or ulcers, or your stomach is inflamed, like gastritis, or if you have any ulcers in the first part of your small intestine.
So, Dr. Burse, you said, Dr. Burse, you know, I hate to keep you on my show, but I'm talking about and keep bringing you back. But when you talked about the stomach and the gastritis and stuff, you know, that's a whole nother topic of this gastritis, right? And with the inflammation, right? Can that gastritis cause this acid reflux also, or no?
No, they're separate. So
okay, they're separate. Okay,
gastritis is just basically inflammation of the stomach. So that can be due to a bacterial infection called H. pylori. Medications like aspirin and Motrin can cause irritation. Stress can cause irritation. But we use the same antacid medicines to treat that as well.
To settle that your stomach area down. And then, so you said that you guys do the, or they sometimes say upper GI, right? No, yeah.
Yeah, they say upper GI, but usually when a gastroenterologist says upper GI, we're talking about the X-ray test.
Okay.
We drink the barium from the esophagus. That can still show reflux and some damage too. It's not as good as the EGD or upper endoscopy, because
upper endoscopy.
Yeah.
And so how do you determine, like, what percentage of your patients come in have to actually, how many, do you do a lot of those tests?
Oh, quite a few.
Quite a few. So how does a patient know if they, I mean, I know the doctor should tell them, right? But okay, don't be on his self-diagnosis and go to the doctor. Yeah, okay. So how does a patient know that, you know, I know by partnering with the doctor, going to the doctor, but if they're going to the doctor, they're not going to you, they're going to another gastro, right? And how do they, what symptoms or they are having that may warrant that test, or should they be requesting that test?
Right. Well, patients who have refractory symptoms, meaning they've been on, you know, antacid medicines for some time, maybe 6 months, 3 to 6 months, and they're not getting better. Those patients who have, you know, troubles, difficulty swallowing, they've developed some weight loss along with everything that's going on. Though all those patients should have an endoscopy. Patients who have long-standing reflux for years, you know, 4 or 5 years, should probably have one exam just to make sure that they don't have any of those changes that I mentioned before, like Barrett's esophagus. But typically, if they come to me, they're probably tried everything. So probably the next step would be to take a look.
To just so you can, so as I always say, so you can have a baseline of this is or this isn't, is to just take a look and see. And then you said that you're sedated for that also, right? Okay, so you're sedated for that, and they're just going to check and look around the same way they do the colonoscopy, and kind of so you can get a baseline of where you are.
This one only takes about 5 minutes. And when you
is that done in office, or do you have to go to the surgery center to do that?
Well, we have our own endoscopy center right next. Well, it's part of your practice. Different offices, but they're joined. You can walk from one to the other, so they're right there together.
So is the colonoscopy done there also? Okay, so both of them. So for the naked eye of us commoners, we would say that's the surgery center. No, yes. Okay. Okay, so it'll be a surgery center. So it's right next door to you, and where you are. Okay, great. So
anesthesiologist and another Morehouse man
that works with you. Okay.
And we, you know, and like I said, it's just 5 minutes.
Okay, I understand. Okay, I understand. And so, Dr. Burse, so with acid reflux, what do you want us to remember most about acid reflux and management and control?
Diet. Diet. Most of the time, those symptoms will improve. You know, you had mentioned your girlfriend with the belching. She probably needs to see somebody. That can be a symptom of reflux, but typically belching is more related to swallowing a lot. Like you're swallowing a lot of air. So people either they eat too fast or they chew a lot of gum, you know, things that make you swallow a lot. They chew a lot of gum or use a lot of like candy, and they're constantly sucking on candy, things like that.
And that's what she does. She's a candy eater.
Carbonated beverages, those cause you to belch. But I mean, reflux can do it. But if you tried antacid medicines and it's not improving, then more than likely it may be related to something else.
And you said it with the putting the air in there, like, yeah. Oh yeah. So see, I learned something new. See, I didn't know that. So I learned something new about the air going in the belching burping problem, as we called it, that causes this to happen in the excess air going in. And you said something that most people don't think about in the chewing the gum, right? When you chew gum, how much air goes into
you swallow, you're swallowing that saliva that you're making all the time you chew. So you add more air into your stomach.
Now, does that add more acid too?
Well, it stimulates
self-diagnosis. No, I'm just kidding.
It stimulates acid because you're faking your stomach out. You're making it think it's about to eat something and nothing comes down.
You can't do, let me tell you what you can't do. Nothing. You can't, no, that's what people gonna say. That's what they say to me. If you listen to your show, you'll be like, you can't do anything. And so I often don't tell people to not do, I say, do things in moderation. That's what I say. Do things in moderation, right? Because we're all human and we're gonna do bad things. But when you do bad things, like, but drink some water to dilute some of these bad things that you're doing. Don't just do bad things, and hope that you're going to be okay. You're going to have to do something to dilute, these bad things that you're doing. Whenever I'm talking to somebody, depending on the population, I have to adhere to how I'm going to reach their population. So yesterday, on Saturday, I was at a record store day. And so it was a lot of hip hop people there. And of course, I spoke and tell them about the podcast and tell them about what I do. And they necessarily didn't want to hear that, because it's like, well, Virgo, you my help. We in here with the hip hop and we got drinks. And I said, I drink, right? And I said, but you do things in moderation. And if you're going to do bad things, I'm not telling you not to do it. I'm just saying, be conscious that you're doing it, right? Do it in moderation and make sure that you're drinking water, because if you don't do these things in the long term, you may not be here to listen to the music, right? So I love music, but you have to be able to be conscious of the things that you're doing and be aware, right? And educate yourself. I say often, that's why I do the podcast, is so we can educate. And even me, I don't know these things, and I'm asking you. I'm learning about these things for myself also. And that my husband and daughter probably be like, oh Lord, she didn't learn something else with this acid reflux. Because I'm really about managing. If I can manage something, right, and not take a medication, that's what I'm gonna do. I'll take a medication, but if I can manage something, and I've learned how to manage my acid reflux. So if I've learned how to manage my acid reflux, y'all ain't gonna kill me by telling me to come on, let's go get some Mexican food, and I can't eat this Mexican food right now. But I also I put water in I put lemon juice in my water. I'm a big lemon juice person because it helps move my mucus, because I have these severe allergies, right? And so I know that the downside is that it's citric, right? And so because I do that, I just try, I don't have a lot of it in my water, but I make sure that I'm getting the water down so I can dilute that also. So all of those things we have to be conscious of, right? Correct, Dr. Burse?
Yes.
So what are our takeaways? And again, when do we go to the doctor?
The biggest thing is we mentioned diet, exercise, eating right, all those all help. Now, obviously, if you got symptoms that are more than like 3 episodes a week consistently, every now and then you may have a bad week, but consistently having 2 weeks of bad symptoms, you should see your primary care physician and or you can come see us. But
Come see you. So how many doctors are in the practice with you, Dr. Burse?
just me and my partner, Gary.
Okay, and you're in the Atlanta area.
Right at Emory Midtown.
Because people listen to the podcast all over the world. So we're in the Atlanta, United States of America area, right? And if you're in that area and you need because look, hey, Dr. Burse, so I'm supposed to go get my consult for my colonoscopy. And this is me. Now I hate I made this appointment because I should have just went to Dr. Burse, right? That's what I literally was thinking. Right?
As long as you get it, that's all that matters.
Correct. No, I totally agree. But you want to go to people that you trust, right? And you also want to go to people that you're able to ask them questions. They're not intimidated by your line of questionings, and those are the doctors that I try to have on my show, that you are able to ask them questions. And Dr. Burse, thank you for coming on to help us to understand. And as we talked about it before, we were talking, he's like, listen, this colonoscopy thing, we got to talk about it. Yes, Dr. Burse, because I am 54, and I promise you, I have so many friends who tell me that they have not gotten a colonoscopy, right? In which they moved the guidelines to 45, right?
Correct.
Exactly. So his is why we're going to be talking about that next.
What's that now? It's not always their fault. Sometimes physicians aren't as educated as they should be on screening exams. Yeah. So I tell people, look, it's never too late. And, the biggest thing they worry about is taking that prep. But, it's.
Well, the prep has gotten better over the years, right?
Right.
So you don't have to do. I know when my husband had his, I said, "You sure that's all you got to do?" And he said, "No, they said they've changed it over the years. That you don't have to do as much."
That huge drug you have to drink, but now some small ones.
Yeah, science.
It's just, and the procedure itself is 15 minutes of inconvenience for a lifetime of health.
That's right. And it's good sleep. I always tell people, you just take some propofol like Michael Jackson to get some good sleep. Of course, he just abused it. But seriously, and we'll talk about it on the next show, but my play mom, my best friend's mom, just the day before my birthday, died of colon cancer. And because she had a polyp that was removed, and then she had another one that they wanted to watch. And so she was supposed to go back in 3 years, right? She didn't go back in the 3 years. And then, of course, we went into COVID, right? And now she starts to having stomach problems. And so then when she goes back, she has colon cancer. And she wasn't able to get any treatment because she was too weak because she got nauseous, she was throwing up. So she wasn't, and so it happened really fast. It was like October, they diagnosed her to have colon cancer, and she passed in February. So it was, when things of that nature happen, it's always a bit personal for me because this is what I do. But I was just so angry because it was preventable. You know what I mean? Like, so, and so it angers me because it is preventable. And her husband had prostate cancer, so she was taking care of her husband, and he's still alive, and she's gone. You know what I mean? So I just say, as women, we tend to take care of everybody else and not ourselves. And so she got lost in the shuffle of, when do I go back? I don't go back. And she's taking care of him and his prostate cancer. And again, he they almost about to eradicate prostate cancer. You know what I mean? So, and so now he's still here, and now she's no longer with us. And so it's very sad to me, but I often use her story to say that, hey, listen, this is preventable. And I told them that on Saturday. I said, hey, listen, you gotta get your colonoscopy, because this is a preventable cancer, and we have the screenings to prevent, right? So I can't wait to bring you back on to talk about that, Dr. Burse. I enjoyed being with you. Thank you for thank your wife, and thank you for even coming on the show to help to educate us, right? Because I say that this is for Afro descendants, and we have to have somebody that's looking out for us, right? People often say, I'm so happy that you do public health, that we don't really have Black people that do public health, but we do, but they don't do it on the side that I do it. They work at the CDC. They're paper pushers. They're administrators. That's not who I am. I'm with the core of the people. I got to get out here with you to see what your needs are so I can help you address the needs. And there are a lot of me out here, but I'm telling you, if it wasn't for the partnership with you and other doctors, then I could not get this information out to everyone. So just thank you for being on. I look forward to the next show. You know, now, Dr. Burse, you know you'll be back Wednesday, but we know you said show. Okay, I'm just making sure. You get your mind right, same time, same station. Thank you so much, Dr. Burse. You see, I see how I did. This was good on your time. See, it's just been our time. I got you on and got you off. So thank you so much for coming on, and I'll let you know when it's released so you can watch. And so a lot of doctors will say, hey, if you want this broken down, go listen to the podcast. And so they don't have to do it so much in the office, because I know you have to see a lot of patients. So hopefully this is broken down enough so people can understand, know when to go to the doctor, know when to say, hey, I need to do this. And I'm hoping that someone has gotten something out of this show. So thank you so very much, Dr. Burse. And tell us one more time your phone number to the practice.
It's 404-881-8800.
My birthday is February 8th, so I love 8. So I'm going to remember your number because it's got all those 8s in there. And I know, no worries. One thing got nothing to do with the other. Thank you, Dr. Burse.
All right. Take care.
Okay, take care. You have a good evening.
All right, you too. Bye-bye.
Bye-bye. Wow. So acid reflux, the plain truth. Dr. Burse just gave us the truth. Let me go to my song, or my featured song for today, or my soul note for today show. My producer, I'm gonna have to fire her. She had to go to work and she didn't get all my stuff together. Maybe she did, and I'm gonna tell her that I talked about it on the show. But my song today for today is none other than PJ Morton. PJ Morton, I think this is my first time featuring PJ Morton on my show. But PJ Morton is an independent artist, and he is out of New Orleans. I think you may know his pastor is Dr. Paul Martin, and PJ does neo-soul R&B, and he has a new album that's due to come out, I think, at the end of this month, called Watch the Sun. He's one of my favorite, other than Eric Roberson. He's my second favorite artist, other than Eric Roberson, but I love PJ Morton. So PJ Morton has a new project coming out, and one of the songs on the album is called My Peace. And I love this song because, as we were talking about with the doctor about stresses and all of those things causing your acid reflux, this particular song is talking about, don't mess up my peace, don't ruin my peace. And so it's one of my favorite songs thus far that has been released until the full album comes out. PJ Morton is on social media at P as in Paul, J as in Jacob, Morton, Morton. Let him know that you heard about him on the Rhythm Notes of Health podcast. And when his new project comes out, make sure you're supporting independent artists and their projects that they're doing, because they don't have the mainstream music entities to get their music out there. And so hence is why I feature them on him, because my love for music. So check him out and check his social media out, and let him know that I sent you over the Rhythm Notes of Health. So listen, I know it's been a long time since we've been together, and you're like, where's this lady with this podcast? Where's the Rhythm Notes of Health podcast? So we're back for season 2. I'm excited, but some things does not change, as is we're still talking to doctors who take holistic approaches and try to help educate you about your health so that you can partner with them to have a better health. So I'm excited about this. Dr. Burse, he'll be back, and we're talking about colonoscopies and when you should have them and those things. But today we were talking about acid reflux. And acid reflux, as he told us, is very common. Most people have an episode or 2, but if you have 3 or more episodes a week, then it's time to go see the doctor. Your race and where you live should not determine whether you live, That's why I do the Rhythm Notes of Health podcast for underserved populations who may not normally get this information. We repeat what we don't repair. That has not changed. That will not change. We repeat what we don't repair, right? And when life moves fast and your mind does too, remember to breathe. It would help get you through. And that's for me too, with all the stresses that I have going on and life challenges. Just remember to breathe, take 5 deep breaths 5 times a day. And hopefully they'll get you through. Until next time, I am Kai Ayanta with the Rhythm Notes of Health. I'm the soul of public health, and I will see you soon.